In fact, in the first time of taking Bioxyte, we all experienced, because I'm also a cancer patient, I'm a prostate cancer patient, and I'm right now facing this operation of it according to my test. So I still have to go a little bit more, but I don't think I will be on for more than 15 days, and I will be over. But the point that I wanted to make is that when I started to take Bioxyte, after his conception, I realized that Bioxyte, I could feel it vehiculizing through my arms and through my chest.
Yeah, I did too.
Yes.
Yeah,
you know.
definitely. I thought something was wrong, but it was actually that it's
for
working.
Diane, she sure feels that.
Yeah.
No sensual feeling.
I mean, it is like a tractor trailer going right through you, you know.
But you didn't.
It's like a vice grip on my
You
chest.
see, it's different for,
Isn't
I
it
guess, the
funny?
three
It
of us, you know, the
Yes.
different
Yeah.
problems
Yes.
that we have.
Yeah.
So, but yeah, I did feel what Dr. Frida's felt. And,
Really?
yeah,
Yeah.
yeah.
No.
And
Now-
he warned me too.
Linda had other problems because Linda was so traumatized that she couldn't understand the adhesion to the program. Okay, she wanted so bad to get out that she wanted to run away from the thing. And who will not understand that, you know? I mean, it's wonderful that you have made that fence you around so you can escape. Okay, and it's wonderful that you have me, that I get you in your house and that's it, and you stay there. But Linda was difficult because first of all, she had a very little faith in that she was going to experiment any type of recovery anytime soon.
Right.
Okay, and my words were not reaching her because the trauma, it was so phenomenal that, you know, we had to go through almost a fatal curve with Linda to finally get her out, you know.
The first time I was diagnosed with the cancer, I didn't know Dr. Frida's then, but I went through chemotherapy. And after 6 sessions of that, I was in remission. I worked for about a year and a half. I was doing fine, but my weight, I was still a little lethargic, you know. But anyway, I just thought, well, that's just the cancer. And then what happened was, it came back second time. Second time, again, I had to go do some more chemotherapy that my doctor recommended. And my son was the one who introduced me to Dr. Frida's. And Mom, you got to meet him. You know, he makes sense what he's talking about and everything else. I says, okay, well, good, let's meet him. And we did. And he didn't like, Dr. Frida's didn't like the fact that I was going to do chemo because I was still swayed, like, oh, I wasn't unsure if this person is telling me the right thing. And then I had this other oncologist, you know, that kind of like, everybody said he saved my life, which he did. He did a great operation on me. He did save my life. And unfortunately, that's all they know, these doctors, just the medications and all those horrible, terrible things that it just poisons your body. So the second time I did chemo, I kept doing chemo, but I was also doing Dr. Frida's protocol. And that helped me. Didn't lose weight, didn't get sick, didn't lose my hair. I had energy, and I just couldn't believe it. I says, you know, doing chemo seemed like nothing. But what was working was what Dr. Frida's was telling me to do. And I says, okay, I had this beat. 6 months later, I was, again, ovarian cancer. The CAT scan was taken, blood work, and the stupid tumor was back again. Twofold this time. And I said, okay, I decided not to do chemo anymore. And I called Dr. Fia and says, you know what, I think I'm going to have to listen to you this time, and I will do your protocol. And I did, and here it is, 6 weeks later, and I am like I said before, my oncologist with CAT scans, blood work that was done 2 weeks ago. As you know, everything was perfect.
Yeah.
Last October.
Okay?
That was a
Last
miracle.
October.
Just a miracle.
Go home and put your things in order.
Right, it's the end.
Instead, he traveled to Florida to meet me. How many months ago is that now?
Well, it was October, the beginning of October, I think it was, wasn't it?
Yes.
November, December, January, February, March, April, 6 months.
6 months.
That's when I got the diagnosis.
months.
Yeah.
What kind of cancer?
he has a myelodysplastic, you know, a leukemic principle. Yes.
It was the worst.
And a very bad prognosis, very aggressive.
Bad.
It's a blastic form. So blast is present, keeps on going. No, blast is no longer present. You know, thanks to the Lord, it's no
Thank
longer
God.
present. So, yes, and his blood work is near perfect.
Really?
Near perfect. We're getting in there.
Yeah.
We're getting in there.
Thank you.
Okay.
Yeah.
Near perfect.
Right, right, very good.
And the only thing we could do was blood transfusions, and we did the blood transfusions as much as we needed to. It was the only thing that we did.
That was to keep the hemoglobin up. Because the hemoglobin, once it drops below 80, they have to transfuse you. And,
Is that like a course of replacing all your blood?
no,
or
just
just-
adding to it.
Just adding to them.
Depending on how much, what the hemoglobin is at. If it dropped below 80, sometimes they give you 2 units,
Okay.
sometimes 1 unit.
Which is a 6-hour deal in the
It
hospital.
was an all-day thing. It
All
was pretty
day.
nasty.
Yeah.
You'd sit around people that you knew you wouldn't be seeing much longer. It was
That's sad.
pretty
Yeah, pretty
horrendous.
depressing.
Yeah. The same thing with chemo. You're
Yeah,
surrounded
sure.
with people,
Sure.
you know, getting these injections, and
Yes.
some of them getting bad and sick, and you know, not coming back or not seeing them again. It's very depressing.
Yes.
But yeah.
Well,
we need more of you, Dr. Friedez, and a lot of more people
That's
like you.
We'll clone you.
Was just
Yeah, well,
gonna
can we
say that.
clone you?
But he has to figure out the method because none
Yeah.
of us can do it.
That's
And it's tough. It's really tough getting word out to people today because, I mean, I have to tell you, I know you're not going to like hearing this, but I went back to work Tuesday,
See what I'm
Wednesday.
telling you? She is a go-getter girl. Yeah.
But-
She didn't go back to it.
I didn't go back.
Probably a couple days.
Just for a
She's
couple of
feeling-
days. Well, I'm working tonight. Floyd called me up and he needs me
Alright.
tonight because his wife is ill, so he wants me to, you know, work for her, which is good. I'm just working to, you know, fill in for
She's
people.
feeling it.
Oh, Linda,
But
you.
I felt good, and the
not
thing
fun.
is, because I've been with the restaurant for so many years, I had like a lot of the same customers that come in, and they're always asking about me, you know, how I'm doing with my cancer and stuff like that. And I start talking about Dr. Frias, and I keep telling them about my protocol, which is great. They
Yes.
want, but you can still see in their minds, like I felt the first and second time, about alternative medicine. You know what I'm
Yes,
saying?
yes.
A little, and they don't want to get into it. You know, unfortunately, when you have some illness like that really hit you, you know, like cancer, and right away it's death. Everybody hates that C word. You understand what I'm saying,
Yeah,
Diane?
I do.
And,
I do,
and
exactly.
It's horrible.
I'm right
and,
with
and
you.
People, you know,
You
they
know,
don't
you're
want
dead. That's it.
Yeah,
Alternative, forget it, you're dead.
yeah, and it's terrible.
Only the
you know,
doctor, only the chemotherapy is the only thing, radiation is the only thing that can cure you. You try anything else, you're dead. That's
People-
it. That's
people
the
don't take a
mindset.
close look at that because what we noticed is that every time she did go back for the chemo, it was a shorter period of time after the treatment that the cancer
Cancer
started
came
coming back.
Right.
Mm.
It was
So
getting
if
shorter
that's
and shorter.
what the end result is, and if you keep doing it and it keeps getting shorter and shorter, and what is it doing to your body at the same time, to the organs? That's not a
Then
good situation.
there'll be your terminal. You know.
This is one
I
thing
just think
also
that's
that.
just it's just buying your time.
Yeah.
That's all that's doing.